panel discussion and almost workshop on AI, artificial intelligence, and this is in collaboration with the Indian College of Cardiodiabetology and Metabolic Diseases and Doctors AI. Our founder president, as you all know, is Professor Dr. N. Rai, and our current president is Dr. K.K. Parikh. And the founder president of Dr. CI is Dr. Amit Kumar De, a very good friend of mine, and another dean of the Indian College of Artificial Intelligence in Medicine is Dr. S.V. Kulkarni. He has also been my mentor and very good friend. And today we need to collaborate and we need to more about each other. So I had a discussion with Dr. Amit De earlier, and we decided that we'll introduce the Doctors AI here so that more and more members of this can also become members of Doctors AI, and that Dr. Amit they will tell you something about it. And then we'll ask Dr. S.V. Kulkarni to basically give us an idea of what the AI is doing. And then ultimately we'll have the panel discussion moderated by none other than just Dr. Smita Bhatt. And we have got a very erudite panel today. Dr. Anuba is there, Dr. Shaival Gua is there, Dr. Shanumugam is there, and we have Dr. Lotika Purohit. So without wasting much time, I will request our president, Dr. K.K. Parikh sir, to please deliver the inaugural address.
Thank you, Dr. Virmani. It's really a pleasure and an honor for me to welcome all of you to a very important Dean session of online CME and a very important topic which I must compliment Dr. Virmani for having today, AI in metabolic medicine. We all know that AI has become very, very important part of medical profession now, and we cannot go away with it, that we do not want to learn it. I think both the things are important: clinical judgment, clinical analysis, clinical medicine. You cannot replace all these things with AI, but definitely we can have assistance of AI in for everything. But the empathy, the empathetic hand you put on the patient's head, that cannot be replaced by AI. So we need to do exercise for our brain for all these things, and we finally use our brain to diagnose the things. So I think today we have got a very important speakers. I welcome Dr. N. Rai, founder, president, Dean Dr. Virmani, Dr. Amit Kumar De, my friend Dr. S.V. Kulkarni, moderator Dr. Smita Bhatt, Dr. Shaival Guha, Shivangam, Dr. Latika Purohit, Anubha, and so on, and Dr. Abhishek, M.K. Singh. So friends, I'm seeing so many learned and stalwarts of medicine present today. So I will not waste time in my address, and I hand over the proceedings to the Dr. Abhishek. Thank you so much.
Thank you, sir, for your kind words. We all know that AI has come in a big way, and it's revolutionizing the entire health industry. And but we need to use it judiciously. We know it cannot replace doctors, but it is very important that it be used as an ally, as a friend, and we can use a lot of routine work delegated to AI as an assistant, and we continue with our clinical interaction with patients with compassion and empathy. And that is the ultimate aim. So the vision of CCDSI and the Indian College of Cardiodiabetology and Metabolic Medicine has been to spread awareness about metabolic medicine and cardiodiabetes amongst the various doctors throughout the country. It started as a dream project of our founder president, Professor A.N. Rai, and gradually we have grown into almost 13 chapters. and there are more than 600 members now, and we are growing at a rapid pace under the leadership of Professor Dr. K. K. Parikh, sir. And I hope and our aim is also to collaborate with other organizations who are having similar intentions and similar aims. And I thought it would be very nice to collaborate with Doctors AI, because not only Dr. Amit Dey is a very good friend of mine, but I am also been a Dean's Council member in the Indian College of Artificial Intelligence in Medicine. I've been given this honor by Dr. Amit Dey and Dr. Kulkarni, and I feel that we should collaborate and go further to improve this awareness amongst the doctors and clinicians. Now, Dr. Amit Kumar Dey has been the founder of the Doctors AI, and it has grown. We recently had a physical conference in Mangaluru, and it was a grand success where people from not only the medical fraternity but also the IT industry and health industry and the pharma joined together to work out ways in how we can improve the use of AI in health industry and ultimately for the benefit of patient care. That is very important. So without wasting much time, I will request Dr. Amit Kumar Dey to talk about the vision of Doctors AI and ICAM, and something about what research products they are doing and how they want to collaborate with us, and what information, what type of help they want from us or from our members. So over to you, Dr. Amit Dey.
Thank you so much. A very good evening. Thank you so much, Dr. Virmani, sir. At the outset, my humble gratitude and my heartfelt pranam to Professor A.N. Rai, sir, founder, president of CCDSI, Dr. K.K. Parikh, sir, the current president, Dr. Virmani, sir, and of course, to all my dear friends in the CCDSI. I have also been actively part of your organization, participated in the state chapter conferences, and many congratulations for having 13 chapters. And I truly believe there is a lot of synergy. I represent Doctors AI and the Indian College of Artificial Intelligence in Medicine, an organization that has been working on three primary pillars: education, research, evaluation, and validation of AI and technology tools by the doctors for the doctors. So it's a doctors driven organization led by the doctors, driven by the doctors in the interest of the patient community, in the interest of the healthcare fraternity, and towards better precision care in a most patient centric way. So that is Doctors AI in a nutshell. I also welcome all the delegates, and maybe many of you have joined in from Doctors AI also, from our community. Once again, we are very happy to have Professor Virmani sir as one of our honorable member of the Dean's Council, and we are going to be planning a lot of activities going forward together. I also welcome Professor Kulkarni, our Dean at the Indian College of Artificial Intelligence in Medicines. So dear friends, I will take the first 10 minutes to give you an introduction of AI in metabolic medicine. I'm very happy to see Dr. Smita Bhatt, Dr. Shaibal Guha, we just met last week at the fantastic RSSDI Bihar conference. And also my dear friend Dr. Shanmugan, Dr. Anubha actually agree to be a part of an AI panel, which when I was discussing this with Dr. Virmani, I said that, we should have one person from each corners of the country, and we should see if they are interested in discussing artificial intelligence. So that's a great start. It's a great start for the fraternity. So my task will be, to give you an understanding of how artificial intelligence can actually evolve in the field of medicine in a very scientific way. My subsequent speaker, Professor Kulkarni, will of course give you a tidbit how you can get started with AI, how to use it for your daily practice, and small snippets like that. He's a person that has been doing this for many years, and he'll be the right person to speak on it. But I'll try to give you some scientific evidences and literature and how Doctors AI, the Indian College of AI in Medicine, and CCDSI can collaborate towards some research work going forward. So dear friends, when we try to define artificial intelligence, there are a lot of ways in which try to say what AI is. And I think this is a very beautiful slide created by one of our colleague, Dr. Avnish, in our organization. And I acknowledge this slide. This is the simplest way of understanding what AI is in the context of healthcare. So you look at this pyramid, and this pyramid has each layer, and each of these layers has a meaning and a depth to it. So as you see, the bottom of the pyramid, the base of the pyramid is basically formed with data. So there is no AI without data. Every AI will have to have a lot and lot of data. That is the raw data. Now, what we do with the data is that we analyze it, we process it, and that becomes information. This is actually the same thing that happens in our brain as well. We are flooded with lot of data of medicine. We try to process it to our understanding of information. Now, the question is, how do we use this information in terms of context, in terms of experience, is basically the knowledge. And how best we use it is our wisdom. So, just like the human brain has evolved in the field of medicine, all of us have become from a good clinician to a wise clinician, and we are in the pathway of becoming a wise clinician. We look at artificial intelligence as a tool also to help us do the same thing. If you look on the right, for example, 7 is a number. Hemoglobin of 7 is an information. A person has come to the emergency department with a hemoglobin of 7. That is my knowledge following a road traffic accident, which means now I need to act on it. So that is my wisdom, that I will check for the source of blood loss and I will arrange for blood transfusion. So this is the flow of information from the base of the pyramid to the top of the pyramid. That is artificial intelligence. That's the human intelligence going through an algorithm. That is artificial intelligence, a very simple way of learning. Why artificial intelligence, and why should we look at also artificial intelligence from our point of view, beyond our regular activity, beyond writing research papers, beyond trying to create PowerPoint presentations? Those are always there. Those are always superficially there. Because when you look at medicine, we look at only the tip of the iceberg when we talk about evidence-based medicine. But if we try to dig deeper with the data and the information that comes and the knowledge that it can give us, we will be looking at more data-driven, intelligence-based medicine. And this is apparently why we need to use more and more data analysis, more and more information-driven solutions in the field of metabolic medicine. How does it work? So you give the input, it undergoes some algorithmic process, which is the analysis. We call it machine learning, we call it deep learning, and it helps us in terms of giving you some pattern recognition output. Could be in the form of classification, regression, prediction, or generation, kind of similar to the conventional statistical algorithm that we have learned in our preventive and social medicine days, with a little bit of algorithmic twist happening here and there. That is called machine learning. So it's not a very complex technology altogether. It's very easy, and this is the hardcore AI. When we talk about AI, it's not about ChatGPT. ChatGPT is an advanced form of AI, but when we look at hardcore AI that can really impact medicine, it is machine learning that we are talking about. Now, why are we looking at metabolic health and artificial intelligence? So when we say metabolic health, we are looking at diabetes, obesity, we are looking at fatty liver diseases, we're looking at thyroid problems also, right? So these can always have data points which can be identified and patterns can be recognized. Out of that, we can have disease risk detection, we can have treatment optimization, complication prediction, and adherence support. These can be actually augmented with the help of data-driven science, and that is what AI and technology can bring in the field of metabolic medicine. So as an organization, Doctors AI have taken a step where we can actually create a platform where if data is collected, we can make some meaning out of it. And this has been our primary goal in the field of research in medicine with AI going forward. Now, what I speak, is there really some research on it? Well, look at this, created again with AI, but look at the number of studies that has gone in creating it. About 1100 studies have looked at, and the systemic review kind of tells us that a lot of studies have gone, and a lot of AI work is done on thyroid and endocrine disorders. There's a lot of AI going on, AI application going on in field of diabetes, in metabolic syndrome, obesity, and recently, one of our colleagues have also started looking at pattern recognition data points even on MASLD and MAFLD. So these are some of the studies that is happening worldwide, and this is a PubMed search. So I've just put it on AI, and it's a PubMed search result, which tells you the number of publication that exists. Now, diabetes, of course, I have said in many conferences, and all of us have also discussed how it can improve risk prediction, CGM integration, complication detection, effective management. Now, CGMs are also coming with AI-powered tools. Pumps have got AI algorithms going forward. If you look at metabolic syndrome as a whole, now there are some machine learning algorithms like XGBoost or Random Forest, which has been tried. And the numbers that you see here are basically the area under the curve of these models. And they prove to be very, very sensitive in predicting certain patterns. One such has been tried on the the NHANS cohort, which is the open source data which is available, and this has a longitudinally available data. So a lot of patterns have been created on metabolic syndrome on the enhanced cohort, and this is something which is well proven, and the sensitivity of this model is looking very good. So there are a lot of papers on this. So if you get some interest point on this, you can just quickly go back and read on this. In obesity management, now you will see a lot of tools are coming in which are going to provide AI optimization, personalized care for behavioral management and behavioral modification for weight loss, also towards risk prediction and early identification. And of course the variables are there which gives a real-time monitoring and a real-time coaching, so that can augment. Now we're talking about this in the era of GLP-1, and we have to really prove that is these digital tools really effective, are they really improving the weight, or is it just a hype? So we need more and more studies to actually prove that these digital tools or the AI tools which we talk about is not a hype, but it actually has an impact in real-time outcomes. There are some papers that also looks at predicting outcome of a bariatric surgery, again using machine learning and pattern recognition algorithm. Thyroid disease is something which we don't speak about, but this is a place where AI has been used a lot of in a lot of advanced way. Whether machine learning and treatment can in terms of treatment response as well as nodule detection. No, in terms of nodule detection, basically image analysis has been done, and convolution in neural network has proven to be very, very effective. When you look at thyroid cancers or any other metastatic cancers, you can use machine learning models which can accurately identify and localize the metastatic lymph nodes and enhance the surgical planning. So every time you look at identifying some pattern, which the human brain has been trained to do through our medical knowledge, is something which you can train an AI algorithm to do. And that is the depth of AI. The true essence of AI is when you are able to use a pattern recognition algorithm to give you a prediction of a disease which has not even occurred in a primordial stage. And that's the true essence of utilizing this technology. Even in cancer classification, like the Bethesda classification, algorithms are now being used to provide a better predictability as to the progression. Just the last segment of the research, if I want to show you that if some of the models that you look at which has been used in diabetes, MAFLD, thyroid malignancy, obesity risk, most of these are machine learning models. Whether it's a random forest, CNN is a deep learning algorithm. XGBoost, as you see here, is also an advanced machine learning models. And diabetic retinopathy, we all know that we have the fundus cameras where the CNN is used as a convolutional neural network is used as a prediction. So overall, there is a huge research which actually exists in the literature database if you look at AI and ML being used in metabolic medicine. Now, why are we supposed to be interested and why are we supposed to read about it? Because we, each of us, each member of CCDSI and Doctors AI, we are sitting on dearth of data. And we literally don't have the idea that this data can provide so much of pattern and so much of identification and help us understand our patients and disease patterns better. All I'm requesting everyone is to go back and look into these researches, and you might find a need gap where you feel that your data point might match, and you might be able to come up with an algorithm going forward which can actually give you a better predictability of the clinical outcomes. This is something which has to be driven by the medical community and the doctor community in real time. And why? Because of this. AI will actually help us see what we have been missing. We talk, we practice, we preach, but there's always a gap. This is the technology that will help us solve this if we are able to use it in the right potential, in the right way. Now, what is Doctors AI? Of course, an organization started as a community in 2023. Now we have more than 5,000 doctors connected globally through the social media connect. The Indian College of AI in Medicine has 500 plus members. As I said, we have three pillars. First focus pillars is the education, which we are doing through certificate courses, workshops. The second is, of course, create a research network, and that's where the collaboration can happen in real time with CCDSI. And of course, we do the summit, we do our webinars, monthly activities where all of you can be a part of, and all of you are already a part of because I get the opportunity of sharing our activities on your platforms as well. The focus is by the doctors for the doctors. So the Indian College of AI in Medicine came up with a structured platform which will enable training, research, standards, and collaboration. The training part, we have taken it up very well, thanks to our faculties at the certificate course, and now it's kind of a global program. In terms of research, we are lacking because we don't have data, and that's where collaborators from CCDSI can bring in that data. So what we are looking at is data acquisition with the help of clinicians as principal investigators and put that to organizations which can work on the data and create some validation framework. Or if there is a product or if there is an algorithm, then take it to you so that you are able to validate as an end point clinician, being the clinician in the loop. Also, we keep discussing about the governance, the privacy, because the focus is responsible adoption of AI. And this responsible adoption will only happen if the doctors are in the epicenter of this development happening. It is not going to happen if the tech people are making it and they're asking us to adopt it. It's going to happen if it's co-built with the medical professionals going forward. Two pictures I want to show you of one of our recent development. Of course, the Indian College of AI and Medicine. We recently signed up MOU just last week with the ICMR, National Institute of Research and Digital Health and Data Science. And this is a milestone because the whole focus of this MOU has been that the government of India realizes also that we don't have enough data, because we as doctors, we are sitting on a lot of data. So we have created this pathway where we will be able to provide structured data from clinicians to the ICMR for their projects. And these are projects which are funded projects. The government gives a lot of grant for these kind of projects. Also, there was a lot of requirement from our community members who are seeking for ethical clearances, from ICMR at a quicker response rate. So this MOU will actually facilitate all that. And we are also looking at capacity building, increasing the capacity of the education courses, the literacy program that we are going to be doing in collaboration with the Indian Council of Medical Research as a collaborator. So we're very happy and we are very proud that ICIM got the opportunity of having this collaboration with the ICMR, and we believe that now we are having the National Health AI strategy being made by the government of India, and it is going to be released in the India AI Summit in February, and hopefully we will have a representation from Doctors AI there, and all the voice of the medical community, all the voice from our collaborator organization like CCDSI will be taken forward to the government of India. The second picture that I show you on the right is an ongoing collaboration that we're going to have with IISC, the Artificial Intelligence Center of Excellence. They are already working on 5 projects, out of which 3 projects are on metabolic medicine. They have a project on breast cancer detection. They have a project on AI retinopathy. They are also working on a project of screening for microalbuminuria and creating a pattern of early recognition of CKD based on microal presence. Now they don't have data and they want real point data and they want validators from the medical community. So the picture that you see is our recent visit in Bangalore at the IISc, and we are very happy once this collaboration gets going, we will reach out to all of you so that you can all be a part of such projects and you can contribute with re-identified data and be part of the ecosystem where we are making meaning out of data that we are all sitting on. So friends, this is Doctors AI for all of you, a community that has been built by the clinicians and for the clinicians. I thank you all for believing in this entire ecosystem that we tried to create. This was a very new ecosystem, and this is something which has done well. And I'm sure with collaborations from CCDSI, from the support of mentors of CCDSI, this collaboration will only go forward. Before I end, of course, I will invite all of you who are watching this, who are a part of this, that like you are a member of CCDS and an active member of ICCMD, we'll invite you all to become a member of the Indian College of AI in Medicine as well. You see the QR code on the right. You can scan the QR code, be a part of the community, and let us grow together, because this is not just the future of medicine, my dear friends. This is the present, and it's happening really, really very fast. Thank you very much. I will end with this very important note to all of you, that from as clinicians, we have to be curious and adaptive to learn about the AI algorithms. We have to come out of this wow and ask the how question and make sure that these algorithms are put in the right place in a responsible way. Thank you.
Thank you, Amit,
Very nice.
for a wonderful talk. You have covered 3 areas. You gave us the vision of Doctors AI. Then you told us what ICM is doing. And then you gave a bird's eye view of the use of AI in metabolic medicine. All these things are quite helpful to us. In the end, I would just request you to say in 2 sentences, what would you expect from the members of the CCDSI? In what way we can help you and how we can collaborate?
As I said, I am believing that 2026 will be the year where Doctors AI will look at many more research projects. Now that we have collaborations with the ICMR and the Indian Institute of Science, and we are also going to have some collaboration with medical institutes. So we want private practitioners, we want doctors who are not associated adequately with government institutes, and they don't get part of being projects and being part of research. We want all of you to come forward, be part of whatever research projects we undertake, and validate, evaluate, or provide data so that a scientific model can be made. But most importantly, what is important is that you get digitalized. You need to make sure that your data is on the digitalized ecosystem and not only on the pen and paper, because once you're doing that, a lot of meaning can be brought out of the data, a lot of sense, and most importantly, many understanding algorithms can be brought out, and that is true artificial intelligence, my dear friends.
Right. So research is very important and also collaboration during our
Yes,
individual conferences, I think.
absolutely,
We
absolutely.
we can have a session of Dr. CI and you can have a small session of
Sure. All that is already there, sir. All that is already there. We have our course,
all that
and
is
we would
there.
love to have a structured
Just to inform
course for
everybody.
you. Yes.
Yeah, they just
All
need
that is
to.
already there. Yes.
Thank you. Thank you. Now we'll move to our second part of the program. And I would like to introduce my good friend and mentor, Dr. Kulkarni. Dr. S.V. Kulkarni is the head Department of Medicine, MGM Medical College of MGM Medical College, Panvel. He is founder, Dean, Indian College of Artificial Intelligence in Medicine. He is a founder, co-chair, Diabetes Mellitus Technology, Diabetes India. He is the president of the Maharashtra Association of Physicians of Maharashtra. And he is a very good friend and very interested, and his aim is to build India's future in medical AI. So over to you, sir. Dr. Kulkarni, please go ahead with he is going to talk about, give us a brief introduction of what AI is so that we all are on the same platform when we go for the panel discussion. Over to you, sir.
Yes, thank you. Thank you, Dr. Anil. And I must appreciate the initial comments made by our past dean, past president, Dr. K.K. Parikh. In fact, he is one of the very instrumental person in taking digital technology in API also at a very, very high level. I hope my slides are visible.
Yes.
Yes. So Amit has given a very, very good start for me, and he has covered almost 50% of my presentation. So I'm going to have some only passing remarks on what he has already said.
Kindly make it full screen.
Yes, I'm making it full screen. Okay, now it is okay?
Yeah.
Yes,
Yeah.
yes, yes.
So what I'm going to do in the next 10-15 minutes is I'm going to give simple explanation of the core AI or machine learning concepts relevant to the clinicians, giving some practical examples in diabetes and metabolic disorders. What do you mean by risk prediction? What do you mean by decision support system? How you analyze the CGM? What are the things which are going up in the field of ECG, echo, just a passing remark. But what are the first steps for physicians? What are the tools you should have? What are the skills you should and how to critically appraise the AI solutions? I start again with a welcome from Doctors AI and Indian College of Artificial Intelligence. And thank you, Anil, for your kind introduction. Friends, I bring you greetings from this place. Actually, the place which you are seeing here is the Navi Mumbai airport, and which has started functioning just 2 days back. A big question is asked, why AI matters for physician? Why a doctor should be enabled with AI? I can give you some very simple things that AI uses computational models to detect patterns. This is called as a pattern recognition. So what do you do with that pattern? You make predictions, and on those predictions, you can recommend decisions in a way that the complement, not replace the clinical judgment. It is the speed, it is the volume, and it is the quantum which is more important. Especially in diseases like diabetes, AI enhances early detection, risk stratification, treatment personalization. The future of clinical medicine is a personalized medicine, while potentially reducing the clinician's workload and administrative burden. Suppose if I go on telling you the technical details, that what do you mean by deep learning, which is a part of machine learning and which is a part of artificial intelligence, and the generative AI is the top of it, like ChatGPT and Perplexity. I just give you a simple example. How do we go to a medical college and punch ourselves? That is all facial recognition. There are lakhs of medical teachers in the country. How it picks up it? That is with the help of deep learning. Just to give a simple example. So Amit talked about structured data. So what AI does actually with data? AI systems for healthcare typically ingest structured data like labs, your vitals, your notes, your medications. Very important, never to forget drug interactions. Unstructured data, your clinical notes. It all depends upon your handwriting. That is the reason why Amit was saying that we should have a digitalization of data. Then from data, you come to sensor streams like continuous glucose monitoring, different kind of variables. It generate predictions. What kind of prediction? A hypoglycemia risk. I'll explain it at the time of CGMS, or classifications, NFLD or other liver diseases. A modern CGM plus AI system learns patterns of glucose variability. What are your meals? It can take a picture of your meal and carb counting can be done. It adjusts your insulin dosing and activities to forecast the near-term glucose and suggest a lifestyle that can predict, and it requires adjustment of altitude. Now, from this introduction, let us come down to something called as a clinical disease support system. The DSS should be rapidly recognizing emergencies. It will be very useful in the emergency rooms. It stratifies severity, for example, a diabetic ketoacidosis. It suggests evidence-based management. It tells you the red flags and the contraindications, the drugs which are adapted to pregnancy, chronic kidney disease, chronic liver disease, and don't forget the elderly population, which is increasing day by day in our country. At the same time, it avoids over automation. Finally, the doctor remains the decision maker. But in India, especially, we want everything to be explained. Every recommendation should include some evidence. For example, a lady coming with gastroenteritis or constipation, and if you take that lactulose is preferred because rifaximin safety in pregnancy is not established. With a click of button, you can get this information, lactulose versus rifaximin in the early pregnancy. Now, from clinical medicine, let us go to a AI-enabled ECG. What AI-enabled ECG does, it detects different arrhythmias like atrial fibrillation, ventricular tachycardia, different kinds of AV blocks. It gives you flagging signs of ischemia, non-STEMI as well as STEMI. Very important in the reducing the door to needle time. A person who is illiterate but literate enough to send an image of ECG can save a life. It identifies all the chamber enlargement like LVH, left atrial enlargement, RV strain, and pulmonary embolism. It predicts future risk, atrial fibrillation, heart failure, in mortality in some models. I happen to attend one lecture in person by Eric Topol, and I'm going to share one ECG, which is absolutely means you just can't imagine that one ECG can diagnose a dozen conditions. It reduces your interpretation time and inter-observer variability. You normally use the 15 type of measurements for your interpretation. If you predict something more like asymptomatic LV dysfunction, AF risk, mortality, which is embedded into some of the GE systems, which are the new things, which are a bit costly. But definitely, situations like institutions like Mayo Clinic are doing a lot of research and tertiary care referrals also. You can be also a part of it. Take this example. What it tells, enhanced detection of AF in a single lead electrogram using a cloud-based AI engine. So this is the AI and this is the cardiologist view. So it is telling you that this is atrial fibrillation, this is a normal rhythm, this is a sinus rhythm total, but this is a premature atrial contract. So all the things can be picked up very easily and you can get the report, and at least you can sort out which is life-threatening and which is not life-threatening. So what we want to tell people, practice, predict, and protect with the help of AI. A deadly condition like cardiomyopathy, giving rise to sudden cardiac deaths, unmanageable congestive cardiac failure, you can pick them even at the cellular remodeling phase during the surface electrograms. You can identify clinical cardiomyopathy prototypes before it develops into symptomatic disease. And then there are many hidden labels before you diagnose by traditional criteria, but at least you can help the person to have a comfortable life by early detection. This is in Marathi, but that doesn't mean that all the work of AI should happen only in Stanford and Harvard. His name is Dr. Gurunath Parale. He has devised a vest. With even a 4-limb amputee person, we can take a ECG. And this ECG goes directly to his center and it analyzes. So this is a patent, very rare for a doctor to achieve a patent. And I'm really proud of Gurunath Parale because he is member of our Dean's Council. This is what I was talking to you. This is not my slide borrowed from Eric Topol. You can diagnose age and sex from ECG. You can predict ejection fraction. You can have difficult diagnosis, so many. You can predict anemia. You can predict atrial fibrillation, diabetes and prediabetes, filling pressure, hyperthyroidism, kidney disease, or even peripartum cardiomyopathy. Those who have treated peripartum cardiomyopathy, a very horrible disease for a young age, you will thank this kind of ECGs. From ECGs, let us come to X-rays. Where the X-ray department is there, it is in your mobile. But what you can do with X-ray? This is AI is in for early detection of chest nodules in X-ray images. It can tell you up to 95% predictive analysis that whether it is malignant or benign. This is a standard reference. I'm going to share these presentations with you, plus many other Word documents, but this can pick up a adenocarcinoma. And this adenocarcinoma pick up in a non-high risk patient, non-smoker, a female, non-exposed to chula smoking. This is the magic of AI associated radiology. Is it possible to suspect diabetes from chest X-ray or PFT from the face? Yes. This is a study of more than 1.5 lakh of the Chinese patients, and this pattern predicts that the person is likely to develop diabetes almost 8 to 10 years before. Friends, you will agree with me that from diagnostic now, let us go to something therapeutic and monitoring. There are two major changes which happened in diabetes care. It was either classified as a pre and post insulin era, and one invention which changed life of millions, and the other thing which I put is pre and post CGMS. So how AI and CGM can integrate with each other? It picks up the data every 1 to 5 minutes. There's a lot of machine learning, deep learning models. Don't worry about it. There are contextual inputs like meal. You can take a food plate picture. How much of insulin? What are the activity? Jogging, walking, swimming. What was your sleep? Whether it was associated with snoring. It predicts, prevents, and personalizes diabetes control. What it adds to the third step is a feature extraction. AI devices the rate of glucose change, that is called the delta G per minute. Glycemic variability. If you have got high glycemic variability, you are a candidate for development of cardiovascular diseases, peripheral vascular diseases, and worst part is sudden cardiac death. What is the time of day risk windows? When a person, if you are, suppose you are working in shifts, then what is the chance of having a hypoglycemia at what time? What are the postprandial excursion profiles? Or whether it can even pick up you a dawn phenomena signatures. So friends, for an average person or even for a super intelligent person, it is not possible to pick up all these things. So what it does in predictive modeling and outputs? So it gives a glucose forecasting 30 to 120 minutes. This is with the thing called as a reinforcement learning. It adjusts the insulin. It can give a message. And there is something called as a clustering in a phenotype-based diabetes pattern. And it will tell you that this person is likely to be settled with 60 units of basal and 10 units of act rapid 3 times a day. It learns outputs from the data patterns. We talked about it. This is the pattern recognition, which is one of the essential thing. This is the hypoglycemia prediction alert. It will not give you alert at this place. It will give you alert at this place in the form of a alarm or sensor which is attached to the mobile. Then at the same time, hyperglycemia risk probability, you will have arrow which will show you that it is going up and up, and it will even tell you the post-meal glucose peak prediction. So you can adjust your meals according to that. So friends, it is a win-win situation. Diabetes is one of the very difficult to treat metabolic disease. It gives a decision support, insulin dose suggestions, meal timing and carb adjustment, activity recommendations, basal rate optimization for the pump users. And this is a continuous learning loop with a human being in the loop. So it model updates from the patient's response. There are personalized glycemic targets. I don't want at the age of 70, my fasting sugar should be 100. I am okay with 120, but it gives you me adaptive alerts. So it reduces my alarm fatigue. Not every 10 minutes my CGMS is beeping. Lotika will agree to that. When we start with CGMS with people, they come with that, iska awaaz pehle band kar do. So from CGMS, let us go to one more bedside test, which is called as a AI-enabled echocardiography and ultrasound. This technology is used for echo acquisition, automated measurements, and AI-assisted interpretation. What AI brings into echo? Automatic quantification and measurements, left ventricular ejection fraction, chamber volumes, LV, RV, both atria, the strain analysis, very important, and the reduces manual tracing time and inter-operator variability is the biggest factor in a country like ours. So go to this website, eco.ai, you will find lot many other examples. Then it detects certain things, it reports the certain things, and it helps you to stay within the guideline limits. So what are the disease detection aids with echo? Algorithms that flag patterns consistent with heart failure, isolated left atrial enlargement, which correlates with the PTF, raised P terminal force on the ECG of the same patient. Significant or critical valvular disease, mitral stenosis of less than so and so millicentimeter square meter. Cardiomyopathy, very important. Then it has got reporting assistance, automated generation of structured report, whatever the important things which are filling, and integration with clinical guidelines with assisted interpretation. That is one thing which we have to do. It is not only the evidence-based, but both evidence-experienced and AI-guided thing which will help. But there are certain problems with all AI tools, clinical benefit, limitations, and practical considerations. So why AI echo matters to practice? It speeds exam and reporting times, is critical in high volume cardiac labs, improves reproducibility amongst users, helps non-expert people to do a basic echo. But AI is not diagnostic on its own. The clinician oversight remains essential. Accuracy depends upon image quality, type of machine, poor acoustic window, validation across diverse population is ongoing. Some additional features require additional amount of licensing from the manufacturers. Friends, I can go on and go on showing you so many different kind of instruments, but few of them which are of interest and which are likely to use, that this is a ring which will tell not only blood glucose, HbA1c, ECG, heart rate, and oxygen concentration also. This is an Israeli product. This is called the Noga. It is a hybrid non-invasive glucometer. It is showing you the glucose. It is showing a A1C non-invasive way. Needs validation. Certain. This is a cuffless BP apparatus which has got additional 15 parameters which will give you, which is approximately correlates with the invasive tests. This is simple to use, portable. The problem is cost 1,36,000 rupees. Amit was talking about the project, that diabetic nephropathy by using AI. This is already in market. This is simple dip, which is just scan this barcode and then you get the report or even the CKD classification of the person. Diabetic foot management. This is from Dr. Mohan Center. The last RSSDI, one of the speaker had a fantastic presentation on this, and he told that with the help of camera, you can even detect a potential infection, a callus, as well as some other abnormalities too. Last part of my talk. Where are the ethics? What are the regulations and what is the Indian context? The ICMR ethical guidelines for applications of AI in biomedical research and healthcare outline the 10 patient-centric principles. What are they? Accountability, autonomy, data privacy, safety, equity, and validity, which should guide any clinical deployment in India. Clinician must remain ultimately responsible for decisions. AI system must be used with informed consent, clear communication to the patients about benefits and its limitations, and robust local governance and audit processes. If you are interested, you can click on this YouTube channel and you will find a very good 1 hour lecture on how to use AI in an ethical way. So with Amit as a founder and Dr. Anil Virmani as my Vice Dean, we have got a vision statement. We have got a not only local, but national, but global vision. Our mission is to transform medical education and healthcare delivery through strategic AI integration. All the models what Dr. Amit have told. And we have got MUHS, Maharashtra University of Health Sciences. I think every state has got. We are going to have a collaboration with them also. A MOU will be signed very soon. What are going to be our core objectives? Expand equitable access to AI education across India, improve healthcare outcomes through AI literacy, drive innovation in medical AI applications, position India as a global leader in medical AI. And when we are grounded to a evidence-based policy, along with good data, good clinical knowledge, and WHO digital health standards, our research and publications will definitely increase. Our H index of the country will increase, and we will be really a time will come, we will be the toppers of all AI research. And for all of you, I would like to just tell you something more, which this looks like a bit odd, but if you study this, is one of the best academics which I have come out of. That what are the aspects of AI you want to know? Accuracy, simplicity, validation, adaptability, bias, risk, and guideline integration, and what are the resource need. They give a simple example. Pen paper is okay, EHR computing required, but it is a context dependent choice, and again the cost and training is involved. There is one more metrics which is called as a discrimination, CSTAT, calibration, reclassification, external validation, data requirements. Most important is explainability. The trust barrier for clinician is the most important thing. I'm not going to bombard with some of the Greek, Roman, and Latin words about AI, but one thing is very certain: it is not a hype, it is at the bedside. AI in metabolic disease, we can have interactive transitions, consolidate learning, and surface the real world concerns. Simple example, I have got a patient with 15 medicines and I want to understand what are the drug reactions going on. I just open Perplexity or ChatGPT, I put that PDF or that even the written prescription, and it tells me what are the drug interactions. You can take audience poll ideas in patient education. There's something called as a Kahoot. There's a live app shows, we can show off hands and other thing. For example, where do you most expect AI to help you, whether it is a risk prediction, treatment selection, follow-up monitoring, or administrative task? The answer is yes for everything. Then we can even discuss about amongst ourselves which AI use cases in diabetes are ready for routine deployment today and what are the still experimental. How should Indian clinicians use the ICMR AI guidelines, and what training and safeguards are needed for all of us without de-skilling the clinician. I don't want to de-skill. I don't want to erode the physician-patient relationship. The Dr. Parikh told about it, that the doctor-patient relationship is the most important thing in this era. So let us be more wise and more practical physician with the help of artificial intelligence in medicine. We are always there in form of Doctors AI and Indian College of Artificial Intelligence to be associated with. Thank you very much. Thanks a lot.
Thank you, Dr. Kulkarni, sir. Wonderful talk, and you have covered a lot of new things. I think for most of them, you have told us how it works in diabetes and risk prediction and genetic AI and chat box and all that. So I just like to emphasize two things. As you very rightly said, we need to use AI, but AI has to be transparent, responsible, ethical, and regulated, patient-centered, with concerns of data privacy, and it has to be monitored even after development. We have to keep on monitoring it so that we know how we can further develop. And the last point you very nicely raised was, and we had a wonderful debate at the last AI conference also, whether AI empowers doctors or de-skills doctor. I think the choice is the doctors, whether they want to be empowered or they want to be de-skilled. So it is, the judgment is with the doctors. And I remember in one of the talks a few months back, even our Honorable Prime Minister Shri Narendra Modi ji said, AI is here for you. It is for you to decide how to use it. As simple as that. Now, is there any poll, Dr. Abhishek? Do we have a poll, or should we go ahead with the panel discussion? Dr. Abhishek, are you there? Okay, there is a poll.
Sir, please go with the panel discussion. We can have poll at the end.
We want to have poll later?
The
Yes,
questions are there.
Okay. So we'll have a poll later, and now we'll shift to the panel discussion. And the moderator is Dr. Smita Bhatt, as I said, from Mangaluru. She's a renowned diabetologist, a wonderful orator, and supporting her will be Dr. Anuba, Dr. from Prayagraj, Dr. Latika Purohit from Mumbai, Dr. Shanmugam from Chennai, and Dr. Shaival Guha from Patna. So over to you, Smita. Please go ahead with your poll, with your panel discussion. Sorry.
So good evening, everyone. A pleasure to meet you all. As we all have been discussing, there's hardly an aspect of life not touched by AI, and medicine, more so data-rich metabolic medicine, is not an exception. To add to the discussion on how we internists, diabetologists, and metabolic physicians can use AI for good, we have a panel of distinguished experts. Apart from the other luminaries in attendance today, we have experts in AI in medicine, Dr. Amit Kumar De, Dr. S.V. Kulkarni, and our panelists are Dr. Shaival Guha, Associate Professor of Medicine in Netaji Subhash Chandra Medical College in Patna. And we have Dr. Latika Purohit, who's the Director, Diabetes Care Center in Kolaba, Mumbai. Dr. Anuba is a well-known figure to all of us, HOD Endocrinology, MLNMC Prayagraj. And Dr. Shanmugam, who's a Senior Consultant Diabetologist from Chennai. So my first question will be to Dr. Shaival. Dr. Shaival, can you share specific examples from your experience where AI has been applied in metabolic medicine for risk stratification, such as predicting diabetes progression or optimizing treatments like insulin dosing?
Yeah, I think we are already using them. We have all heard about the Framingham risk score, and we have seen recently that the AI-enabled risk stratifications, which are used to see the cardiovascular risk in diabetic patients, have shown to be more accurate than the Framingham risk score, probably because of their larger base of data and their non-linear mechanism of assessment. Similarly, we have the diabetic foot ulcer prediction models. They are also pretty accurate in measuring the and identifying high-risk individuals who are at risk of developing diabetic foot ulcers. We also have seen the US FDA has recently approved them, the IDX-DR and the DEEP-DR, these to the models for diabetic retinopathy. And they are fairly accurate by screening and detecting signs of diabetic retinopathy from retinal images. And they predict the onset of diabetic retinopathy fairly accurately. So we find that in all the fields of metabolic disease, especially in diabetes, AI-enabled models are coming up fast, and they are pretty accurate than the conventional ones. Yeah.
Agreed. And also your artificial pancreas, for example, your hybrid closed-loop insulin delivery,
That's right.
that also relies heavily on AI. Dr. Shaival, another question to you.
Yeah.
Have you encountered any specific challenges in validating these AI predictions in diverse patient populations? How do they compare to traditional clinical methods?
Yeah, that is a challenge because algorithmic bias and fairness is a big issue. AI models are susceptible to inheriting the amplified biases present in the historical data, leading to performance disparities across different demographic groups. And the generalizability is also the factor. The models often fail to generalize to new populations or clinical settings. So these two are the major factors, and then data quality and representation is very important because a large amount of data is needed for training for the AI. And if the data quality is not consistent or incomplete or non-standardized, then it's difficult to train the AI. Basically, it's trained on the availability of data. So data quality has to be consistent. So these are the main challenges, I believe. Then, and the more complex AI models lack transparency. They are very difficult for clinicians to interpret and understand how they are functioning. So that also gives a lack of credibility to them. So that is one more factor. Uh, I think these are the major challenges for.
Okay.
Yeah,
These are
yeah,
very valid points that you've made, especially in a
yeah.
country like India where the data is so heterogeneous from city to
That's
city,
right.
from state to state. So that's one of the major issues. I do agree with you. Dr. Anupa, these questions are for you. I think this is what most of our audience would be curious about. How can we as clinicians integrate AI tools into our daily workflow? How can we make it easier? How can we, let's say, integrate AI into our EMR as well?
Thank you, Dr. Smita. At the outset, I would like to thank CCDSI, Virmani sir, and the whole senior faculties here for such an enlightenment talk I heard from Dr. Ahmed and Dr. Kulkarni, and I'll definitely become a part of AI doctor only. Coming to my question, very aptly said, the integration of AI in our routine clinical practice can be a lifesaver in our day-to-day works, where we talk about the administrative part, where you want to do the cash counting, the billing, the appointments. So these are simple things which our reception people can learn about it if you can have EMR integrated with the AI tools. Also, this is the first part where which will help definitely to the patients. There won't be any queues. There will be a structured appointment. There will be structured reminders that the investigations is due, that the appointments are due, and then definitely these will help in, as Dr. Amit has shown, in various metabolic practices where there are not many emergencies, but the consultations need to be on a regular time and regular moment. Second point which comes out, I think both the presentation has been very up to the mark. So the clinical decision support system about for the clinicians' purposes, where we have a pool of data for analyzing the patient's data. We talked about the role of AI in our radiology, role of AI in our ECGs, ecos. So this can help us in clinical decision making and treatment options. Another will be automated, like sir told about this. Automated flowcharts are there. You can use in your emergency wards, in your ICCUs or ICUs, where the patients, sick patients are coming. The algorithms are made. The closed loops are there. So you can just have the workstation can triage the patients, and they can actually have a integrated the treatment options are available for the treating physicians without wasting much of their time. So now again, I think I'll take again Kulkarni sir's slide only. The predictive analysis also. For the prognostication, like new AI tools, you can predict the disease in a real time before the disease has progressed. These are the certain markers, these are the certain vitals, and hence the patient has a poor prognostication. So in an era of personalized medicine, where we need to provide a good care, inculcation of AI, it's not the replacement. I'm saying as an assistant, can be a lifesavers from the clinical decision making in the EMR based, in the patient administrative work, where the majority of work is done by the administration AI. But yes, a personalized touch or or the what patient needs, your mental or intellectual personalized care by the physician is there.
Okay. So thank you, Dr. Anupa. Now, even now, even when our country has progressed so much, still there seems to be this mistaken opinion all over the world that we are not IT savvy, that we don't have a good tech infrastructure. Do you believe this is true, or do you think as of now our country has enough infrastructure, enough, let's say, access to AI to use this in our healthcare system? Do you think we have it right now with us?
Dr. Smita, for a wonderful question. First thing you tell me, we are living in a world where you go to have a pani puri, and this pani puri person will have a QR code. You scan up, and he's able to get immediately the money. So we are obviously we can say we are not very tech savvy, but definitely not so. Yeah, there are limited infrastructure, that I will definitely agree. We have poor internet connectivity. We don't have high good hardwares, or we are so much software savvy, but still though the lack of tech support may be there, but we as an Indian population, we as Indian doctors are definitely looking forward for newer technologies, and we definitely will put it with open arms. There are cost and fundings, but definitely if we say the benefit ratio is many. In the era of AI, if we don't learn AI, we will be outdated. So it is the need of the hour for every one of us to side with AI and not talk about what are the barriers in learning of AI.
Thank you so much, Dr. Anubhav. Dr. Latika, the next question is for you. So as I think both Dr. Amit and Dr. Kulkarni mentioned, AI models rely heavily on data. So my question is, do we have enough high quality data in India? And how does the heterogeneity between rural and urban, north and south, let's say higher and lower socioeconomic status as well, how do these impact the validity of the data that we have? Dr. Latika?
Yeah. Good evening. Thank you so much for inviting me for this panel discussion on AI. It is really very interesting, and I think we live in very exciting times wherein AI is here to support us in our work and probably in managing people with diabetes and other metabolic diseases. So yes, of course, AI is here. It is something which we are all using day in and day out, because the rising burden of diabetes, obesity, hypertension, NAFLD, all this is increasing in leaps and bounds. Of course, it does promise early risk detection and pattern recognition, and the support in the decision making. However, we must remember that this is an assistant for us and not a replacement for our clinical judgments. Also, do we have enough data? Yes, we have large data. However, it is not standardized. We have data from labs, we have data from EMRs, we have data from huge camps, which we all do. Continuous glucose monitoring, we heard Dr. Kulkarni speak about that, other variables which are there. However, there is a lot of gaps in this. There's a lot of fragmentation in the systems. The data quality is not is not standardized. A lot of variability in that. There's a lot of poor longitudinal follow-up is not there. So also, whether the AI was trained on what data is, whether it is the similar to the patient population that you're dealing with. Also, like you said, madam, the rural versus urban divide. There are some places where we have late presentations of diabetes or other metabolic problems. There are fewer investigations available. There are a lot of adherences, challenges that patients have to go through. The north and south divide, maybe east and west divide also. The diet is different. Every 500 kilometers, the diet changes, the language changes, the lifestyle changes. There are, of course, body composition differences also. The affordability, the monitoring frequency also varies, the continuity of care. So all these are very difficult to standardize. So therefore, the actual data that we see, we don't know whether this is really reliable. But so those are some of the challenges that we have to deal with.
Now, I believe I asked this question for most of the audience. When AI gives us decisions, for us as clinicians, it's a little frightening to take that decision if we are not sure about the process that goes into it. In other words, black box AI is a little bit difficult for us to accept. Explainable AI probably would be something we are more comfortable with. Do you agree with this, sir?
Yes, yes. So, like I said, what data did it use? The thing is, ethical transparency is something which is still missing. And why? Because we don't know what are the drivers, what was the data which was actually analyzed, and was it really validated in a primary care setting or in a tertiary care setting? Because, like we said, the variabilities in the country, what are the safe behavior, what about the missing data, what about the explanations in the clinical languages? So these are some of the challenges that we have to deal with, and probably we'll have to work towards getting better, accountability or ethical transparency.
Agreed with Dr. Latika. And dear friends, we know that the world is changing. We are moving away from black box AI to explainable AI. The SHAP and LIME models, these are just initial steps in how we can make, let's say, the way the AI's mind works much more accessible to all of us. We are running out of time. So my last question is actually for Dr. Shanmugam. Dr. Shanmugam, would you like to tell us a little bit about the regulatory hurdles for deploying AI in metabolic medicine, both in India and globally? I believe Dr. Amit has, or Dr. Kulkarni, they briefly touched upon it, but could you tell us a little more in detail about the guidelines, especially in India, to use AI in our practice?
Yeah, thank you, all the panel members, and thank you, Amit, for inviting me. We all know that AI is rapidly developing and it is fast growing, but the regulatory frameworks are not so fast as AI is growing. It is slower. But recently, our Indian government has came with the guidelines of TPDP. It is digital protection guidelines, which the main concern about is the consent. Main guideline will be from the India will be how can we the consent for the AI and digital protection for the data we are going to save, and the ethical guidelines, how to go with AI in an ethical way, and digital health architecture is also being given by the medical aspects here by DPTP laws. And as a doctor, even though we incorporate clinical decision making system in our clinical practice, ultimately the doctor is responsible for whatever the AI usage is, for the data. Not with the agency is not responsible. Only the doctors are responsible as of now. And as you said, the block box, the explainable AI, all these things we should keep in mind that whenever we are using AI in our clinical practice. And there are some issues with the doctors also. There is doctor skepticism about AI, as we discussed earlier. There is about infrastructure about AI, training about AI, bias about AI. All these things are there. I think the recent guidelines will address that, but the regulatory framework is not fully developed. I think in the future time, the regulatory framework will give us a better idea how to go with AI.
Very true. Dr. Shanmugam, you very rightly said that our guidelines have not kept pace with the rapid advance in the field of AI itself. That's a very good point that you made. Now, I do believe we are slowly exceeding our time limit. So can I ask each one of the panelists, in one sentence, say what you believe is the future of AI in medicine, or you can even talk about the present AI in medicine and how you use it. I'd like to start with Dr. Shebal, please.
Yeah. Actually, when AI came, it was thought to be an alternative to doctors. So people were apprehensive about it. But I think we should take it just like any other investigations, like just when MRI came, that didn't replace the doctors. Even an ECG came, that didn't replace the doctors. Similarly, AI is just another tool in our hands, which will improve the sensitivity and accuracy of diagnosis. and reduce the complications of disease and treatment. So it's just like any other tool we are having, and we have to use it to our most. And I see in the future patients coming in, and as soon as the patient comes in, we can, using the AI, we can analyze his risk. Like a diabetic patient walks in, feed in its parameters in the AI, we know that this patient is an increased risk of developing a foot ulcer. So we are more focused on that part. Similarly, when we are prescribing him some medicine, we find that this medicine should be, is better for him, this is not. So that will be another hint AI can give us. Similarly, regarding complications of medicine, this person is more prone to complications of particular medicine, so that AI can guide us. So it's just one more tool in our hand, which we should use toward the fullest capacity, I would say. That's my take.
That point is very well made, Dr. Shaibal. Thank you. Dr. Anupa, in one sentence, what does AI mean to you as a diabetologist, as a clinician, and a teacher?
In an era of in an advanced era where AI is everywhere, we have to adapt to it, we have to accept it, and we have to use in a judicial manner. I think speakers have very well talked about the guidelines, the litigations, the legal aspects also, our role also. So this will be a game changer in the era to come, where if a patient walks in with the AI, it becoming more centralized, more structured, as in the Western world, his whole records, his history, his treatment history, his addiction history, his allergy history, everything will be available to the doctor beforehand as a patient comes to you. So you have the whole medical records, which most of our patient never bring to us. So that would be a great help for a clinician. Without any wasting time, they are able to help to their patient. Well said that. I will not say it is going to replace doctors, because the mental connect, the intellectual connect, the emotional connect of the doctor to a patient, the patient-doctor relationship, the communication will always stay there. We have to use AI in our decision makings, in our because if the AI is available to a patient also, he can do. Does he treat himself? So it is we doctors, we have to guide them how best this can be helpful to them, to us, and a patient and a doctor. We can have a consensus using it, and I think we have a great future ahead.
Thank you so much. Dr. Latika, in your opinion, in one sentence, AI in medicine, what do you think, especially AI in metabolic medicine?
So AI in metabolic medicine is a fantastic tool. However, it is also a tool which is available to a large extent to our patients also. A lot of times they come with a printout saying, or on their phone saying that, these are my symptoms, this is what I've put in, this is what is there. So unfortunately, there's a little bit of probably misuse or misjudgment, because they may not be really qualified to probably, assess what is the impact or probably take action against or on it. But having said that, it is a fantastic tool as long as we use it as a tool to support us in our decision making and treatment of our patients. It is really very nice.
Thank you, Dr. Latika. Dr. Shanmugam, any concluding remarks from you?
Yeah, the AI with the doctors will be the future belongs to the doctors who understand AI and use AI judiciously and wisely as an assistant to their clinical expertise.
Thank you so much. That was very crisp. Thank you, Dr. Shanmugam. Thank you, dear panelists, so much for your cooperation. And thank you, Virmani sir, for the opportunity. It was so nice interacting with all of you. I would like to add one thing. Dr. Amit, we have taken your point forward that we must, as clinicians, we must use AI in research. Thank you all so much.
Thank you, Smita, for a wonderful panel discussion. I would just like to say one thing. There were issues raised regarding the regulatory frameworks and all that. The AI has been expanding in the healthcare industry in a very, very rapid manner. I remember in 2023, just 2 years back, healthcare providers were afraid that AI will replace them, including doctors and healthcare providers. In 2024, healthcare providers were no longer afraid that AI will replace them, but they were afraid that AI algorithms will be done without their knowledge. And in 2025, the healthcare providers are leading the revolution in healthcare. And I congratulate Dr. Amit Dey and Dr. Kulkarni and Dr. AI for being a part of that revolution. And we, from members of the CCDSI, would also be love to be a part of this revolution. And in early this year, I remember FDA has come out with a regulatory framework, a huge document. This is for Dr. Shanmugam. And recently, the ICMR has also come out with a regulatory framework. The WHO is coming out with a regulatory framework. So I think by the end of 26, we should have a lot of things in place. We are still on the learning curve. So we should have a lot of things in place. I would request only one person here. I think Dr. Ravi. Dr. Ravi Kavepalli, would you like to give comments? Dr. Ravi Kavepalli, are you there? I am told he is an expert in nutrition and food care.
Yeah.
Yeah, Ravi, please go ahead.
Hi, thank you. I mean, like, I love the group of Dr. AI, and I try to attend as many meetings as possible. And Amit and Dr. Kulkarni and all of you guys have done an amazing job. It's very inspiring to see this happen in India. And I would love to be a part of any work that is done there. And also, I'm an infectious disease doctor to the base of it, and wound care. But what enthuses me with the metabolic medicine is where energy toxicity or energy inadequacy is causing major problems. And what I was trying to, in the chat box, if you see my questions, what I was trying to propose to the panelists was that what we teach AI is going to reflect back at what it is going to help us through. So I use rampantly the AI at this point in my practice, and it has changed how I think about each patient differently. So I'm able to convert the mass medicine thinking to a power of one approaches. And so energy toxicity in metabolic medicine, wherein we're teaching about glucose, but also ketones, and how the mitochondrial health brings it to it and helps us in healing journeys of our patients. This is amazing time to be a doctor, and I'm so blessed to be knowing all of you, and hopefully will work with this group in making a real impact for India. And that's my life goal. Thank you very much.
Thank you, Dr. Ravi, for your wonderful comments. It was very informative. I think if anybody wants to ask any question, yeah, Dr. Kulkarni, please.
Yeah. I pick up from what Anubha said. First of all, you acknowledge that AI is there at your doorstep. It is not knocking. It is already in your bedroom. So accept it, accommodate it within your day-to-day life, adopt to it, but adopt with authority and enthusiasm. It will help you. I talk about AI in school with the school children also. I always give 3 examples, very simple 3 examples of our day-to-day life. You have ridden a bicycle, you have swam yourself, and you have ridden a horse. Have you any time with a position to learn the bicycle without falling? No, the horse has to throw you out. And while you are swimming, मुंह में पानी तो जाना ही चाहिए. But you are learning 3 good skills. So like that, AI is a good skill. और मेरा पेशेंट को बोलते हैं मैं AI को आने दो अभी घर में, अंदर आने दो, तुम्हारे प्रैक्टिस में आने दो, तुम्हारे कॉन्फ्रेंसेस में आने दो, तुम्हारे पेशेंट मेडिकेशन में आने दो. Even with AI, if you can reduce your one medication error, I am sure that whatever ChatGPT or Perplexity you have brought at a cost, it is of use. And one good news for the people who have got a Airtel connection, I give a voucher of 17,000 rupees to you. Open your AI app, Airtel app, and there is a column called as the claim Perplexity. So you will be in a position to use Perplexity for 1 year. Then after you can apply me, I will give you free. Or Dr. AI will be in a position to give free. So Amit is smiling. Amit has got so many offers like that. He has not disclosed you something really one good big offer. That we are soon coming out with our journal, International Journal of Artificial Intelligence in Medicine, which is going to be a landmark, and we should be really proud as Indians because all the basic cornerstones of AI all over the world are Indians. So we should be very proud and we should always contribute to the betterment of the journal and for the organization. And thank you, Anil, and thank you, the organization, for allowing us.
Thank you, Dr. Kulkarni. I think if there are no questions, I'd just like to end with one sentence. Yeah, Dr. Amit, he wants to
Yeah,
say.
I mean, everything has been said, sir. And first of all, I'm fascinated with everybody discussing AI. 2024, when we start talking about it, people started looking at me and saying, like, what is this guy talking about? I mean, does it even make sense? And today we have Dr. Smita, Dr. Shanmugan, my friend, Dr. Anuba, Dr. Shaival. I mean, wonderful. I'm so fascinated. Thank you so much for accepting the invite of speaking on a topic that is new to all of us. And this is a start. This is a start. And this means we are adopting. This means that we are ready to adapt something new into the ecosystem, something new to our cognition. And I'm amazed. Thank you very much. My whole appeal to all the members of CCDSI will be, please get yourself digitized and digitalized. If there is any way an organization can help its members adopt EMR solution, then we must do that. I know there are a lot of inertia and a lot of barriers of getting into electronic health record, but that's the only way out. We are looking at Ayushman Digital Bharat Mission coming forward very strongly. I've been speaking to the NHA people also, and it is going to be rolled out in a phased wise manner, but every practitioner will have to use it because that's only when you will get a lot of data and you will start making sense of your data. And, I have been using EMR from my experience, I'm saying since 2015. Today, when I look back at the 17,000 patients data, it makes a lot more sense and it makes me look at the way I've been doing things in a different perspective. That is the viewpoint that every clinician should get, and probably we'll be able to do more good than do harm to our patient. My second appeal to all of you is please go and read the DPDP Act. The Digital Data Protection Act is now the law of the land in India. We don't need to read up on FDA. We don't need to read up on the EU Act. We need to only read up on the DPDP Act. There are some clauses which we should all be familiar with, and we must all abide by the clauses because it is the law of the land in India. And not knowing it is actually kind of, I would say, a medical kind of ignorance, because this is something that will come by all of us, whether we are practicing or we are not practicing. So please read that. These are my two appeal. The rest, the sky's the limit. It's there for innovation. It's there for exploring, and I think we are doing it in a wonderful way. Thank you so much again for the opportunity.
Thank you, Amit. I would just like to end the scientific part with one sentence. Please use AI as your ally, as your friend, as your secretary. You are the supreme commander. Remember that, and then nothing will go wrong. And I must congratulate Dr. Amit De for his wonderful talk, my mentor, Dr. Kulkarni, for his wonderful talk, Dr. Smita Bhatt for beautifully organizing the panel discussion, and all the panelists, Dr. Shanmugam, Dr. Shaibal Gua, Dr. Anuba, and Dr. Lotika, for wonderfully elucidating their points. And I think it was a wonderful panel discussion. Now I'll request Abhishek, can we go for the poll before we go for the final moments of this session? Let's have the poll. And what we'll do is that the poll, I think, has to be submitted, and later on it will be analyzed, and the data will be put on the WhatsApp group of the both the CCDSI as well as the Doctors AI. Can we have it? The poll? Can we have the questions? Yeah. So you can fill it right away, straight. Multiple choice.
Everybody just needs to tick on whatever they do and they submit. That's it. It's very easy to do.
Okay, good. So these questions were made by Amit.
No. It was not made by me. So
Okay.
it was an idea that I just gave Abhishek, and I said the rest is up to you and your AI
Yeah,
friend what you're
questions
going
were
to
quite
do.
good.
But it
Questions
So,
took,
so it was done by Dr. Abhishek and his AI.
good, good, good. Dr. Shanmugam, you wanted to say something?
I thought it is made by Amit.
No, it's not made by me. So
That's
that's,
what I
see,
also
as I
thought.
say, we have to be an enabler. If we keep making everything, it doesn't happen. So I'm so happy that
Right.
Dr. Abhishek could come up with this, and now this is a
That's a
great,
good
great
thing.
trend.
Abhishek, I'll request you to analyze the data and then put it in the WhatsApp group. Okay.
Okay,
Now
sir.
I will
Uh,
request. Yeah, I
we,
will.
we can go for sir concluding remark by and sir.
Yeah, I'm
Sir.
coming to that only. Now, before we end, I'll request our founder president, Professor Dr. N. Rai, to give his concluding remarks about how we have done today.
Thank you, Dr. Birmani. I think at the outset I must congratulate our two learned speakers, Dr. Day and Dr. Kulkarni, for excellent talk. And the learned panelists, Dr. Smita Bhatt and Dr. Sawal Gua, Dr. Shanmugam, Dr. Lotika Purohit, and Anubha. I think we had very good discussion. And gist of the today's meeting is that AI is not going to replace clinician, it is going to assist in diagnosis, early diagnosis, personalized treatment, and research. I think this is a take-home message. Thank you.
Thank you very much, sir. I think this was just an introduction about AI in metabolic medicine. In the upcoming CCDSI annual conference, I will request the incoming chairman, scientific, to please include a workshop on AI so that we can have 1 hour's workshop where people interested in AI can really have a hands-on workshop of how to get things done on ChatGPT or how to make presentations and all that. They've got a wonderful module where all this can be taught. This is a request. I think it will be conveyed to the chairman, scientific chairman of the next conference.
Sure,
And
sir.
thank you, all of you. And in the end, I'll request Dr. Abhishek to please give the vote of thanks.
Thank you, sir. It was a really mind-boggling session, and we learned basics of AI. And sir, this is the result is being displayed. However, I will compile the data and put on the WhatsApp groups. First of all, I thank our founder president, Dr. N. sir, our national president, Dr. Parikh sir, Dean Dr. Anil Kumar Binwani sir, the founder chair, and my dear colleague, Dr. Amit Kumar Dey sir, Dr. Kulkarni sir, Dr. Smita Bhatt ma'am, for conducting such a nice discussion, nice panel discussion, Dr. Anubha ma'am, Dr. Shanmugam, Dr. Shabal Guha, and all the panelists who has put their heart in this quick CME, because we didn't give any time to all of them. Just 2 days time or 1 day time, we informed the panelists, and they were happily ready, and they have put their both the experiences and queries which usually comes to our mind also. So there was a very good discussion. I thank all of you. I thank all the delegates, both on this platform or at and on the webinar platform, along with if you are also watching simultaneously on the YouTube. We were streamlined lively. We were live on the YouTube also. So I congratulate and thank all of you for being us, and I hope that Dr. CI will collaborate with us in teaching us and bringing us to the world platform. Thank you, sir. Thanks to all.
Thank you, everyone. I think Dr. Darvesh, Mr. Darveja wants to share something. Darvesh, you want to share the results of the poll or something? Or what is this whiteboard? Are you
आनंद
three dots?
आनंद कुछ आ रहा है क्या? देखो तो इस पे. Actually, sir, we are also new to this technology.
Yeah. So I think I have answered all the questions absolutely correctly. And I'm sure most of them have done it.
Oh,
Anyway,
for the first question, the answer was the B, that it will predict risk, optimize therapy, and analyze
correct.
continuous glucose data. For
Yeah.
the second, again, yes, Second question was very good.
Second question, the answer
अमित
is
सर
all
के
of
लिए
the
था, अमित सर के लिए था basically sir ये.
yeah. All of the above.
Yeah, which are the
Third
key
question,
challenges?
third question is only the first one, predict progression from pre-diabetes to diabetes. The fourth is again predicting cardiovascular risk using lipid. It cannot replace statins or perform coronary angiography or diagnose thyroid disorders. And the last question was we can recommend lifestyle changes based on patient data. We cannot replace laboratory tests or replace endocrinologists or diagnose unrelated. I don't know this. Can we diagnose unrelated neurological disorders, Amit or Dr. Kulkarni? Any?
No.
No, I agree. I think no, but 8% answered yes. Anyway, I think the main is to have nudges so that the lifestyle can be improved, behavioral intervention. So with these words, I think it was a wonderful evening and we had lovely discussion, or very informative. All of us have learned a lot. And I thank again everyone and bid everybody good night and a very happy new year. We'll meet very soon in the next Dean's session. Thank you and good night, sir.
Thank you, sir. Thanks to all.
Good night.
Correct.